Don't be afraid to approach people that are where you want to be and ask them questions. People love talking about themselves, and no one minds telling how they got to where they are. And I think the more I talk to people about how they got to where they are and listen to it, you find out that it is unexpected more so than anything else. People never wind up where they thought they were going to be for the most part.
Welcome to this week's As Unexpected podcast, when we talk to C-suite executives, entrepreneurs, and philanthropists about how they lead into the future when the future generally goes as unexpected. I'm Scott Marshall, your host, and my own professional experience has made me a believer that it's not how you show up when all goes as planned, but it is how you show up when things go as unplanned. Given all of their experiences, each of our guests has become very attuned to the fact that the future is not to be predicted. My hope is that this podcast can help all of you become better leaders by building the core leadership capabilities for leading in an uncertain world. Well, welcome, everybody, to another episode of the As Unexpected podcast. I'm your host, Scott Marshall, and I have to tell you, this is maybe one of the most special guests I've had, if not the most special, because he is such an incredible thinker, writer, practitioner, and I think you'll just be really impressed with what my guest has to share today. Cedric Dark, Dr. Cedric Dark, welcome to the podcast. I'm so pleased to have you. If you wouldn't mind, please provide an introduction to our audience.
Well, first of all, thanks for having me on, Scott. I'm definitely not the most special. There's got to be people that are far more special than I am. But I am an emergency medicine physician. I practice in Houston, Texas at one of our level 1 trauma centers. And if we back it up all the way to, high school, I grew up in the state of Maryland, and I've kind of been an East Coast person for most of my life. I went to college at Morehouse in Atlanta, went to medical school in New York at NYU. And then while I was there, I took a year off to do a master's of public health degree, focusing on health policy and management, and actually spent like a summer working on Capitol Hill for the House Ways and Means Committee, learning how policy gets made or how the sausage gets made in that sense. And then eventually, once I finished medical school, I went back to DC and trained at George Washington University in emergency medicine. And I'm one of the rare people, I think, these days, because back when I did emergency medicine, the program I happened to be in is what we call a 1+3 program. So I did 1 year of internal medicine as a prelim and then 3 years of emergency medicine. Folks that are doing it these days do not like doing floor medicine at all. So they pretty much converted those programs either into a straight 4-year, which literally the class right after me started in that format. So there are literally 2 new classes for our group, and they kind of ignored us because we already knew what we were doing a little bit. And they gave a lot of the attention to the real new people who were fresh into medicine. So I feel like we're a little bit like that, ignored middle child to some degree for our residency class. But after that, I worked in the community in Baltimore at a small community hospital called St. Agnes. Did that for a few years and then eventually moved down to Houston, where my wife's from, and been there ever since. And now I'm like a tenured associate professor, which is kind of insane to think about. And one thing I forgot to mention, which is probably the most important thing, is that when I was a student in college, I did semester at sea in fall of 1999. So.
Very cool. Yes. And for those of you who don't know, we're also very honored that Dr. Dark is a member of our board of trustees, a really valued member of that board. So thank you for that service. It's a voluntary role. We really appreciate it. There's a lot in what you've said. And, I'm going to call attention to a book that you've published recently. And I'd like to get into it a little bit later, but I just want to make sure our audience is aware that this book really brings together all of what you talked about in terms of your background and how you approach the book. So the book is titled Under the Gun, an ER Doctor's Cure for America's Gun Epidemic. and it's thoughtful around public health, emergency medicine, policy, both at the state level and the federal level, and uses this sort of disease metaphor that actually is quite powerful. And again, we'll get into it more. Cedric, the title of this podcast is As Unexpected. My own experience is that it's not how we show up when things go as planned. It's really how we show up when they go as we didn't plan. And would you mind sharing with our audience, given that really wide-ranging experience you've had that's led you to where you are today, maybe some stories, whether they're in the ER room or in Congress, or they're during your training in New York or in DC. Some of a couple stories around how you showed up for yourself and others when things went unexpected, and what lessons we might learn from that.
I think one of the things I learned from semester at C, one of the things that they taught us when we first got there, is you have to be flexible. And I think the name of your podcast makes a lot of sense, because you can't really expect anything to go as planned. Even, as physicians, our lives don't necessarily go as we think they're going to be. Our interests don't necessarily go the way they are. When I was applying into medical school, I was thinking I might want to be a surgical oncologist. One of my aunts had cancer. And I thought, what better way to practice medicine than to kind of thwart the disease that took her from us. And over time, just through the experiences that you get while rotating on different services, but also just things that happen in society at large, my trajectory changed to emergency medicine. One of those big things that I write briefly about in the book was actually 9/11. I was in New York City. I got there in August of 2001. And my dorm room in New York, we still had dorms because it's really expensive to live there. And so the on-campus housing that I had faced south. So looking out from NYU southward, you can see the Twin Towers there. So it was 2 weeks that we were there when 9/11 happened. But yeah, so I was there in New York, and literally I was maybe a couple weekends, or maybe a weekend before 9/11 happened, kind of like the Staten Island ferry, which departs like right down from that edge of New York City where the towers are, with another semester at sea alum, Alina Kwok, and some of her friends, and we had traveled, and we were literally right under those buildings probably a week or so before they were struck. But the reason I tell that story is that when it happened, as a first year new medical student, we had no idea what we could do to be helpful. And we're in this business because we want to be helpful. So the first thing we did was we crossed the street and went over to Bellevue Hospital, which is one of the nation's oldest hospitals, trying to see what we could do. And we were routed somewhere where we signed people up to, register for blood drives, because we figured like that might be needed in sort of a trauma setting where people need blood transfusions. And then later on, towards the afternoon of that day, they had us helping the police move supplies over to Chelsea Piers, which is on the west side of Manhattan, to set that up as like an impromptu MASH unit. And literally for, as far as you could see, there are a bunch of cots and IV bags and all this other kind of stuff that was just sitting there waiting to be used. And of course, none of it actually got used. But those are some of those things that, you don't expect to happen. And then you sort of jump into action and try to be ready for. So that was like my introduction to, I think, sort of disaster emergency medicine. And then again, when I started my clinical years, 2 years later, there's this huge blackout in New York City and throughout the Northeast, actually, which lasted for a few days. And I had just started clinical rotations, and I spent some time in the ED sort of helping out because, again, a lot of the nursing staff couldn't make it into the hospital because they lived in the outer boroughs, and with no electricity, the subways aren't running, and people don't have cars. So it pretty much paralyzed the city for a few days. So I did that as well. And I think those experiences led me to emergency medicine.
Makes sense.
Oh, go ahead.
No, it makes sense. Keep going.
And people typically ask you, now that I'm an ER doc, what's your typical day like? And like, there is no such thing as a typical day, because it completely depends on what walks through the door or rolls through the door. And that could range from, gunshot, stabbing, bludgeoning to chest pain, belly pain, back pain, or I need a medicine refill. I stub my toe. And I work at a place with a lot of indigent. So we have people that, maybe they just need a place to stay, like home resources from the social worker for a homeless shelter or resources for rehab, those sorts of things that aren't necessarily medical in nature. But we still have the ability to provide those resources for our population. So it's one of those things where you don't really know what to expect. You have to be prepared for a little bit of everything. And then a little secret for those of you that don't really understand how doctors work, you have to be able to Google it really fast while your patients aren't looking so that you can kind of refresh your memory on those things that you don't
Of
remember.
course. Yeah, makes perfect sense. There's a lot there. And, I obviously live with a calendar that shows me what my day is going to be. Unlike you just kind of know the block of time you're working, but you don't know what's going to show up between there, I suppose.
Yes and no. So I would say one of the things I learned from one of my mentors is if it's not on the calendar, it doesn't happen. And I think, quite frankly, honestly, somehow this was not on the calendar, didn't make it to the calendar for some reason. I have multiple ways to do this because I know when my clinical schedule is, that imports automatically, right? And then everything else I do, because I'm an academic physician, I do academic things like writing a book
Yeah.
or, teaching residents, teaching medical students, all that kind of stuff. After this, I'm giving grand rounds. Those things I have to put on the calendar physically. And if for whatever reason, when they go from, oh, this is a good idea, here's some date options, if somehow we don't reserve it and put it in there, then like that hole is not reserved. And then, what I try to do is, my boss tells me we work a Monday through Friday academic kind of gig. So if we're not clinical, we're supposed to be doing stuff like this, right?
Oh, yeah.
And so if you don't put it there, then something else might get on that calendar.
I understand.
That actually happened last week. I recorded a podcast with a gentleman that I know from GW. And for whatever reason, I had like a doctor's appointment that was scheduled at the same time because I didn't have that one in there.
Yeah.
And again, in the whole thing of being flexible, luckily it's with the ER doctor. He's like, that's cool. I got nothing else to do today. We'll just move it an hour or two, and you make those things happen.
It all worked. So I'd love to, you mentioned the book again, and I'd love to get into it a bit. And I've marked a number of things in here. But before we get into any specifics in the book, I'd love to get your sense of when did you start to think, I'm going to write a book? How long before you actually started writing did you start to think, I'm going to write it?
Yeah, as unexpected, I had no intention of doing this at all, quite frankly. I would say the first beginnings of this go back to November 2018 when the NRA sent out a tweet that said doctors need to stay in their lane and not talk about gun violence, and specifically gun violence policy. And as I told you, my background, like I have a background in that. Many doctors, physicians do not. And I understand that concept, but there are also many of us that have bridged both medicine and public health, public policy. And for those of us that know how to do both of those things, that was a really offensive statement. And so at first it just sort of became sort of a clapback with a hashtag called This Is Our Lane, which ultimately turned into a New England Journal of Medicine paper that, was spearheaded by Dr. Megan Rainey, who's now the dean of the public health school, I believe at Yale. And worked with her and Dr. Emmy Betts, who's a suicide prevention researcher in Colorado, to write a short perspective paper explaining why, physicians do have a right and a responsibility to speak out on this because we do see this every day in our course of work.
Go ahead.
So from there, maybe 6 months to a year elapses, and a friend of mine, Dr. Seema Yasmin, reaches out to me and says, you should write a book. And I completely laugh it off. I'm like, you're crazy. Why would I want to do that? And then she's like, no, you really should. And I think looking at it with what we like to call the retrospectoscope, she was right. I'm a physician that works at a level 1 trauma center. So I see this stuff. I'm trained in the policy area. Part of what I have done over the past, 15 to 20 years has been trying to focus on evidence-based policymaking across many subjects, but specifically gun violence prevention as one. And, I happen to be a writer. I'm actually an editor for our emergency medicine news magazine called ASEP Now. I've been doing that for going on a little over 3 years now, I think. And so it kind of made sense. And I think to cap it all off, I'm actually a gun owner as well, which I think most people talking about policy in this space are not, or many people are not. And so I think that lends another layer of credibility to it for me to sit there and talk about these things in a way that is evidence-based, informed from the clinical side, but then also with an understanding of someone that's not necessarily anti-gun.
Right.
So
Right.
that's how that started. And that was maybe September of 2019. In my mind, I'm like, there's a new election coming up. So let's get this book written. We'll try to have it written by like election on 2020. So whoever gets elected in November 2020 has this book ready to go. And as we all know, especially the Semester at Sea crowd knows, a couple months into 2020, pandemic hits us. And so all the plans that I had, because I wanted to go travel to a couple places, interview people on site, see what their ERs look like, what their trauma units look like, all that was thrown out the window. And so it became Zoom interviews, right? And talked to a lot of different physicians who I've never met in real life at this point, some of whom I have, but talk to them like this and then use that material to create the book. And then from the time we started to the time it actually gets published, it's about 5 years, which in emergency medicine time is like 2 infinities.
Yeah, I was going to say.
Yeah,
you operate.
It is not something that we're used to doing at all, things that are long-term projects. Usually you spend, literally, I have timed myself going in and out of a room, and it can be as little as 3 minutes, as high as maybe 6 minutes that I'm spending with the patient. On average, an encounter, when you think about how many patients per hour they expect you to see, averages about 30 minutes from the time you see them, do all the work you need to do, look at the labs, look at the CAT scan, turn around, disposition them, go back and speak again to tell them their results. You can allocate about 30 minutes per person. So, and you do that 16 times a day in an 8-hour shift, plus you do a completely different version of that every shift. So to do something that keeps you on track for 5 years is insane in that regard.
This episode of As Unexpected is sponsored in part by Semester at Sea, a study abroad program for college students and adults on career breaks, sabbaticals, or retired, interested in learning and exploring the world together. Learn more about the Lifelong Learner program at www.semesteratSea.org. Well, congratulations on persevering through that 5-year period for sure. I want to go to what I felt was really capturing the heart and soul of the book for myself. And obviously you start with this, but then there's a very concise way to say it on page 156. And here's what you write. Too often our society does not work on eliminating the disease agent, hate, anger, and depression. We focus on other strategies to interrupt the chain of infection. That is the cycle of violence. To me, that's quite profound. And I think of really a bit more inane examples. I think of, accidents, car accidents, because someone's looking at their phone. The phone is really just a vector, but the disease is inattention and distraction and unwillingness to focus and care for oneself and others. I mean, there's some other way to describe it, I'm sure. But this idea that really underneath it all is how are we caring for humans, their mental health, and ensuring that this vector, the weapon, is less accessible or more thoughtfully distributed and owned. So can you explain for our audience a bit further how this root of the book, maybe root isn't the right word, the foundation for it, came about, and describe for our audience what you're really saying here?
Yeah, there's so much packed in that one sentence you read that I could
Yeah.
go in
Yeah.
probably three or four different directions. So I'm going to have to try to stay focused on what you asked, which is sort of the foundation for the book, which ultimately is public health,
Yeah.
and using the public health analogy to approach gun violence. I think that's the most important thread. And one of the things that I talk about in the book is sort of the mosquito analogy. And you mentioned sort of this chain of transmission, chain of cycle of violence, that sort of thing. If you go to the CDC website and type in any disease, they'll show you the life cycle of whatever that disease is. So if we think of malaria as a disease, it comes from a microorganism called Plasmodium, which then resides in the stomach of the mosquito. When a mosquito bites a person, it gets injected into their bloodstream. That then becomes the disease of malaria. And when another mosquito bites someone with malaria, it picks up some of those microorganisms, flies to another person, and then starts that cycle over and over again. And so that is what we would call sort of a chain of transmission in the public health sense. But you can make that same analogy in the violent space as well. And so when we think about it, and I think of gun violence as the example, why do people get shot and or die from firearms? It relates to depression, suicidality, right? That's one thing. It relates to rage, road rage, anger, jealousy, misogyny, all these other things where you might find interpersonal violence, you might find intimate partner violence, those sorts of things. And what we see in terms of the gun is just the mosquito in this situation, because that disease agent that is there, whatever that underlying thing is, has many ways to be expressed, whether it's a fist or a knife. Um, it can be expressed by a gun, and then the bullet is the vector that travels from one person to the next, injuring the next host. And that's essentially the analogy that I work with. And I think there's many ways to disrupt that cycle, and you can disrupt it in so many spots, right? You could, if we get rid of every single gun, you can't have gun violence, right? And some countries approach it like that. They make guns just completely illegal, and therefore you don't have gun violence. It doesn't mean you don't have violence; you just have no gun violence at that point. You can disrupt it in the sense where maybe we can work on people that have depression and provide them like mental health so that they actually are able to cope with their disease, and make sure they don't progress from that to suicidality. Right. And this is what I see in the hospital. I see people that come in, they feel depressed, they might feel suicidal. Our psychiatrists assess their risk, and those people that need it get hospitalized. Those people that are able to cope, and aren't a higher enough risk to themselves, can leave the hospital and get outpatient treatment. So that's one place of addressing it. The police address it in another spot. They wear Kevlar, right? So they address it after the bullet's been fired, but before it enters the body, by putting on protective equipment. So there's a place where you can address it there. And there's many places throughout that cycle where you can address the cycle of violence. And we touch on some of that in the book, but I also like to think of it as policy is a way to address some of those things as well. And so I'm happy to delve into deeper, into specific policies if you want, but whatever you want to talk about is great.
Yeah, you go through and you're very clear on the policies that have impact, right? And you call out where there still needs to be more evidence, whether a policy works or not. I think what might be helpful at this point in time is really to talk about the patchwork of policy that exists in the states and at the federal level, and where you see sort of the positive deviance, if you will, that there's policies in place and that seems to be affecting lower rates of gun-related violence, so that our audience can get a sense that indeed there is a way, that you're not advocating for eliminating guns from the country. You're talking really here about how you find cases where gun violence has been reduced as a consequence of policy.
Right. And first, I need to give the premise. I told you why the book started, which is because the NRA said something stupid,
Yeah.
in my opinion. And one of the things that they said, they actually referred to a book called The Science of Gun Policy, written by the Rand Corporation, which is a well-respected DC think tank.
Yeah.
That I think originally, if you go back to the history of Rand, was created to do studies for the military or something
It
along those
was.
lines.
Yep.
But they have a section of people that all they do is study the science of gun policy, and they put together a 400-page book, which I happened to read. And the NRA decided to rail against physicians that were talking about gun policy, cherry picking one little thing that the doctor said that wasn't supported by Rand, and therefore trying to convince people that there's no good gun policies out there. Meanwhile, there's at least half a dozen, if not more, that are evidence-based solutions to our gun violence epidemic. And I think that's one of those things that we really need to focus on is how do we approach those topics. Now, this is also going to be the thing that I love for post-production, because in doing that, I completely forgot your question. So I'm going to have you reread that, cue me up so I can.
Yeah, that's okay. That's okay. I think for our audience, because it's such a patchwork of state policy and federal policy, do you have cases where you do see, I mean, I'm using the term positive deviance. I'm not sure if that's appropriate, but where you do see policy in place that layers of policy and programming that in fact has reduced the incidence of gun-related violence, whether it's at the municipal, county, state, or whatever level, then in fact there is evidence suggesting that this is affecting that change that we seek.
And so with these half a dozen or more policies that exist out there, one of the nice things is we have federalism, right? We have 50 states plus all these other jurisdictions that are self-governing as well. I had to catch myself because Washington, D.C., not technically a state.
Right.
But and then you also have federal government, which can layer on policy on top of all that, right? So the background checks that we see out there are federal policy that says if you are a federal firearms dealer, then if you're selling a gun to someone, you have to run an FBI background check on them and go through a specific database. So that's one policy. Now, some states have allowed those background checks to be even more expansive to cover even sales between individuals. Like if I sold my gun to you, we might have to do that background check in certain states where we don't in other states. And what this does is it creates what the health services research community would call a natural experiment. Because now you have some jurisdictions that look at something and some jurisdictions that don't. And you can compare what are firearm injury rates, firearm death rates like between places with and without a policy. And so when you have all of those, then you can see stuff like background checks work to save lives, stuff like domestic violence restraining orders that require guns to be surrendered can save lives from intimate partner violence, things like raising the age to 21 or child access prevention laws can save lives, especially in those cohorts that are now prohibited from having firearms. And so we can see a lot of those benefits simply because we have this, people like to always say it's the laboratory of democracy, right? It's inefficient in a way because you have some states doing things one way and then you cross a line and then an imaginary border. And then now all of a sudden you have states doing things completely differently. But it creates a great situation for researchers to study the impact of one policy versus another. And that gives us the science that we can now use to say the evidence tells us X, Y, and Z.
Yeah, that's exactly what I was getting at, is that, the inefficiency of our approach also, gives states the opportunity to implement policy that varies. And as you just suggest, and is really well explained in the book, allows you to really see what is effective and what is not effective in reducing gun violence. And again, I want to emphasize for our audience that Dr. Dark is a gun owner. And in the book, there is no suggestion that we follow the path of other countries in eliminating guns from our society. What he is really advocating for very clearly is to address the disease directly, to reduce the tragic outcomes of that suicide by gun is, as you say in the book, is far more, let's call it effective, or the outcome leads to death much more frequently than it does by any other means. And violence by gun leads to death much more often than it does violence by other means. And can we address that disease really directly through policy? If we can, I'd like to transition because I really want you to also just explore more deeply your own life and this book being an outcome of that life of yours. Two of my favorite people in the world, Kuki and Cam, have recorded a video for us, and I'd like to bring them in because I think it, again, just allows you to really reflect on your own life and share it with our audience. So we're going to pause for a minute. We're going to listen to Kuki and Cam, and then I'd love to hear your response to their question. Actually, it's two questions.
If you could have coffee with any leader, living or dead, who would it be, and what's your first question for them?
That's a really good question. If I could have coffee with any leader, living or dead, I would probably chat with Sarah Blakely, founder of Spanx. I'm really fascinated by Spanx's growth story, Sarah herself being a woman founder and building $1 billion business. And I'd really want to ask her specifically how she had to manage changes to her approach as she scaled, right? Spanx started as a really ground up business and was not always a $1 billion empire. And so I'm just really curious about like how she had to navigate the steps to get there.
Yeah, that's great. I want to know too.
Okay, Cedric. So Cooking Cam have posed this question: coffee with someone that you really respect, whether they are currently living or have passed away. It's not only who would you like to spend that time with, but what question would you ask of them?
Yeah, that's a really, really difficult one. You sent me this video the other day, and I watched it, and I sat and I thought, like, how do I distill that down into not only one person but one question? I really couldn't do it. If you look over my shoulder, there's a few books up here. There's Obama's book there. I think Obama would be a good person that's living to talk to, specifically because of the fact that I think one of the signature things that he did was the Affordable Care Act, which I think if you look at is going to have the same impact on American society as something like Medicare and Medicaid ultimately. So I probably would get into a conversation about that with him. Is where is he thinking that could go, and the struggles of how do you feel when Mitch McConnell tried to villainize that or vilify that law by throwing your name on it, and then how you took it over by accepting that. And now that people, railed against, repealing and replacing Obamacare for so long, you literally have the current vice president-elect essentially telling society that his mom is on Obamacare during the vice presidential debate, but kind of having to hold back because wait, that's kind of against my viewpoint. So I probably would ask him a little bit about that. Another one, I think, I have Malcolm X's, the autobiography of Malcolm X up there. I think it would be interesting to talk to him about his transformation, because I think if you look at Malcolm X and you saw him earlier in his life, he was a fairly militant person that I think mellowed a lot after his pilgrimage to Mecca, and kind of I wonder where he would see our society now in terms of sort of black-white relations, and whether or not he would still be, what I would term sort of black nationalist, almost segregationalist, and see what his viewpoints are at this point in time. I think over here on the top shelf, there's Marcus Aurelius Meditations, which I read this past summer, which is just kind of like philosophical, but it's a fairly interesting thing to read. And I haven't done the history on it fully, but I feel like a lot of the stuff that Marcus Aurelius talks about is very similar to, I think, some of the themes that we see biblically in history. And I kind of would want to approach him in terms of how he deals with his apparent insecurities, even though you're like the emperor, with leadership, and then kind of backing it up further. I think the last person I would think about would be sort of David from the Bible. Like, how do you, you know, you're a man after God's own heart, but you did some dirt in your life, and how do you reconcile those two things? Because I think we expect our leaders in society to be perfect people, which, as I would think even this election can tell us, our leaders are not perfect people. And, how do you deal with that yourself, understanding your own flaws versus being tasked with leading folks? So those would probably be four people that I would want to have coffee with, although I don't know what the coffee would be like in the ancient world. It'd probably be full of a lot of lead. So I might not want to drink it too much.
And maybe it's not coffee. It could be some other elixir of some sort.
Yeah. So who knows what they had back then?
Yeah, that's actually an amazing wide range of individuals, and it does reflect, first of all, that you read widely and think broadly, and are able to bring together thinking from so many different minds and faiths and ways of viewing the world, and that can lead someone to, I think, also be capable of writing a book that's very philosophically profound, but then brings in data to tell the story. So I really appreciate that. Thanks for sharing. It's time to finish up, Dr. Dark, and I'd love if you could just offer one piece of advice to anybody, whether it's on the policy side, whether it's on the personal side, whether it's someone pursuing a medical degree, whatever it might be, or if it's just a young adult who's looking at how they want to explore their life and think about their life. I know you have a few young individuals in your life, that in your family. What piece of advice would you give to anybody right now listening?
Well, if you're a parent, number one, lock up your guns. Yesterday was National Injury Prevention Day. We did a gun lock distribution at our hospital. And since that's on the topic of the book, lock up your guns if you're a parent and a gun owner. Number two, kind of more directly in your question, what would I advise people, specifically like young people, to do? I think realistically, don't be afraid to approach people that are where you want to be and ask them questions. Again, people love talking about themselves, and no one minds telling how they got to where they are. And I think the more I talk to people about how they got to where they are and listen to it, you find out that it is unexpected more so than anything else. People never wind up where they thought they were going to be. For the most part. And this sort of gets into sort of the breadth of the stuff that I like to do for entertainment. I was watching a documentary on John Williams, the movie film composer. And, his family was all musical people, but he had no idea that that's what he was going to wind up doing for his career. And you can see like how pivotal he's been in, I think, probably the lives of every person on this planet, ultimately, in terms of like musical influence and film and all this other kind of thing. But he said something fairly similar, that he didn't really expect to be where he was going to be. And a lot of what happened just happened to be by luck. He happened to be around people that were in positions that then could refer him when there was something they didn't necessarily want to do. And kind of gave him a path. And so you have to take those opportunities when they're there, but still stay true to yourself. I think many people will tell you no is a complete sentence. If something's going to be a complete distraction from where you want to be, do not be afraid to say no to it, especially younger people in academics that feel like they have to say yes to everything their boss tells them. Honestly, don't do that if you feel like it's going to distract you from where you need to be. But when that opportunity does arise, take those ones that push you towards where you need to be. I didn't expect to be an editor of our, emergency medicine magazine, but my friend who was the editor was resigning and said I should take over. And I'm like, nah, man, what are you talking about? He's like, you're the only one really qualified to do it, and then I looked back and I was like, oh, I'd been the photo editor for our school newspaper. I had written some feature articles after semester at sea. I did a 7-part series about my travels in semester at sea that went into our school newspaper. I'd been doing the blogging thing. I was writing a column for that magazine. And so, yeah, it actually was a natural transition into that job. And when I interviewed for it and put those things out there, they're like, yeah, you're the person for it. I wouldn't have sought it out per se, but sometimes those things just line up in life. And I think you got to be willing to do or to take opportunities when they arise.
That's perfect advice. And I can tell you, 10 years ago, I would never imagined being sitting here doing a podcast with you in my current role. Cedric, thank you so much for taking the time today. The book, again, is Under the Gun, Dr. Cedric Dark, based on his experience in public health and the emergency room. It's a great read. Highly recommend it to anybody who really wants to understand how to reduce the tragic losses that we suffer as a country through gun violence. Cedric, thank you so much.
Thank you. Thanks for having me.
This episode of As Unexpected is sponsored in part by Semester at Sea, a study abroad program where students visit 10 countries on 3 continents, all while taking 3 to 4 college classes through Colorado State University. See course offerings and upcoming voyage itineraries at www.semesteratsea.org. Thank you for joining this week's episode of the As Unexpected podcast. The viewpoints and opinions of featured guests do not necessarily represent those of the Institute for Shipboard Education or Semester at Sea. Hit the like button, share it with your colleagues, family, and friends, and remember, be curious, be compassionate, be courageous. That's what it takes to lead as unexpected.